23 ABC's Bayan Wang is joining us live from the Kern County Public Health Department in East Bakersfield. Bayan, what is the holdup on these vaccines?
Jessica, that's the same exact question our local hospitals have here in Kern County, as they were expecting the Pfizer vaccine to arrive today. But as the Kern County Public Health Department reported, the state announced today that a vaccine in Kern County won't happen until at least the end of the week.
Unfortunately, we will not be getting it in our hands until Thursday or Friday of this week.
Dignity Health Dr. Hamal Kathari says the months-long anticipation for Pfizer's COVID vaccine will have to linger a little longer.
We were expecting the vaccine yesterday, actually, and then we thought, well, we'll get it today. And we were told this morning we have it, they have it there. And then a few minutes later, we were told it's not going to come till later in the week.
Adventist Health Bakersfield also expected the vaccine Tuesday, but they're in a similar situation.
So we're looking probably at the end of this week when we'll actually have the vaccine in-house and be able to start deploying it.
During the wait comes a record-breaking amount of new COVID cases in the county as Kern's ICU capacity is dwindling. Kern County Public Health Director Matt Constantine says there are 358 COVID hospitalized patients, with 66 of them in the ICU as of December 13th. That leaves 20 ICU beds available, but according to the state, there are only 6 ICU beds available because they don't count pediatric ICU beds. That's why the state adjusted the county's ICU capacity from 4.8% to 0. The situation grim at the state level too, as Governor Gavin Newsom announces a regretful purchase.
We just had to order 5,000 additional body bags. They just purchased for the state, and we just distribute them down to San Diego, Los Angeles, and counties. That should be sobering.
It's one reason Newsom said the vaccine brings hope. The first round is dedicated to healthcare workers in emergency rooms, ICUs, and COVID units. Next in line is patients at long-term care facilities. But when will the vaccine be available to the general public? Most likely not until next year.
So I think the general population should be able to, I'd say the month of January, latest February, should be able to get the vaccine.
And with the Moderna vaccine expecting FDA approval soon, officials here in town think that essentially that's going to speed up the process for the vaccine to become available to the general public. Now, Governor Gavin Newsom also announced today at his press conference that the state is expecting an additional 393 doses of the Pfizer vaccine by the end of next week, and more than 600,000 doses of the Moderna vaccine by the end of December. Now, Dr. Kathari tells me at some point in this fight against COVID, it's not going to really matter how many vaccines we have. He thinks there's going to be a surplus of vaccines. He says the next issue is going to be having the public actually having confidence in the vaccine and ultimately taking it. For now, we're in East Bakersfield. Bayan Wang, 23 ABC, connecting you.